You are on and tuned in at the Lisa Baxter Show. Today's show is called The Organ, the Other Organ, the Kidney, the Other Organ. And I am on location today, so say location, location, location. We're going inside to interview Kelly Collins, okay? Thank you. Come on in, take the walk, and take the journey. You're gonna love it. Let's go. National Kidney Foundation today, and we are interviewing the best, none other than Kelly Collins.
Thank you.
Hi, Kelly.
Hi, Lisa.
How you doing?
I'm so good. Nice to see you.
Nice to see you too. You looking good?
You as well.
I'm trying. I'm trying to definitely keep up with you. I'm just so happy to be able to do this show on today. I call it the Kidney, the Other Organ. That's the name of this show, the Lisa Baxter Show, the Kidney, the Other Organ. So I'm glad to have you on today, and just going to ask you a few questions, so feel free to loosen up, okay? And I'm going to get loose too. You know, what I wanted to ask you first is, how long the National Kidney Foundation been in operation?
Sure. So the National Kidney Foundation actually started in 1950. And I just joined the foundation a bit more recently, about 2.5 years ago.
Okay.
So they've been, committed to helping patients who are affected by kidney disease and their family since the 1950s. And, we're very committed to prevention, treatment, and also awareness of kidney disease in the general population. As you know, it's a progressive illness, and if people can catch it early and know the warning signs and know what tests need to be done, we hope that people can, hopefully not need to be on dialysis or have a transplant if they can catch it early on.
Wow, you almost answered all my questions in one zoom.
Oh, no.
No, don't worry, since we're taking our time. Well, I would like to ask you, what is your title?
My title. So I'm the Patient Services Director here at the National Kidney Foundation. I'm a social worker. So prior to here, I had worked in a dialysis unit as a clinical social worker.
Really? How was that?
It was wonderful. It was wonderful. Yeah, I worked for 5 years in a clinic, and I guess it's odd to say fell in love with dialysis, but I really enjoyed working with patients who were on dialysis and with the professionals on the team who were so committed to helping people as well. It was kind of a unique part of healthcare where you get to see people, 3 times a week. And really get to know them and their families, and, help them with coping with being on dialysis and the struggles that they face.
Okay. Well, how long have you worked here? You said 2 years?
Yeah, it's been a little over 2. It'll be 3 in August, so about 2.5.
Okay.
And with my background in dialysis, this was a really nice transition to be able to, run the programs that we have for patients. We have a helpline that patients and their families can call if they have any questions about kidney disease.
Really?
And we also have a peer mentoring program, which you know about as one of our peer mentors.
Yes, I love that. You trained me on being a peer mentor.
Yes.
And I've had several of people that I had to peer, and it was such a pleasure to do. It wasn't, always easy, because your heart is touched, your heart deals with that, but it's a beautiful thing. What I love that you guys came together with that, a lot of times as being a dialysis patient, it's much easier to reach another dialysis patient. We know what we're dealing with, we know what we're going through, and we can kind of understand each other, and we can encourage each other because we understand. We've been there, or we know about it. So my hat's off to you guys. That was one of the best things you could have ever done. And what I loved about it also was the training that you gave to me. The booklets covered everything. You were able to answer questions, and you helped all of us along all of this time. So I truly appreciate that.
We appreciate you being part of the program. It's a very special program to us, and like you said, it's so nice to be able to connect, patients with other patients who truly understand, what that person's going through, and can kind of give a real perspective of what it's like and how you overcome and, make dialysis part of your life, but not consuming your life. I think that it's often so scary when people are first diagnosed or first starting dialysis. They
Yes.
feel very isolated, even in a room full of other patients. So
That's the truth.
we can't do it without you guys. Our peer mentors are by far, the best ever. So it's a great program, and I'm so glad you're part of it.
It really is a great program. What made the foundation come up with this program?
We had done a lot of research. A lot of other chronic diseases have pretty extensive support networks.
Yes,
I
they
guess
do.
you always go to cancer and things like that, even
True.
HIV.
Mm-hmm.
There's a lot of online support groups. There's a lot of support groups in people's area, and as you know, there really aren't a lot of support groups for people across the country.
That's true.
And so, we started looking into why is that. I know well-intentioned social workers, patients have tried to start support groups and they kind of fizzle out or don't really end up working long-term.
Yeah.
And so we decided that a phone system might be the best way to reach people wherever they are across the country. We use a toll-free system, so it's no long-distance charges, and protects your privacy as well, your private phone number.
Yes.
And so it's worked out really well. I think that despite where anybody lives, we can connect someone in New York with someone in Louisiana or
Very true.
California, and nobody has to feel isolated and
Very true.
having to go 3 times a week for dialysis. I know people have a hard time, maybe getting out on another day or fitting that into their schedules. So it's nice that we can kind of work around that over the phone.
You even worked out a time with us. I like that. You would always ask me, or you would email me and say, is this time good for you? This time is good for this person. I enjoyed that, and the fact if they want to call me, even though they don't know my private number, you were able to open the lines where they could call me if I've been missing them by calling them.
Yes.
So that has been great and also been helpful.
Good.
Yeah.
Good.
Now, what does a person have to do to get a peer mentor? And then I'll ask you another question after that.
Okay. So if somebody's interested in having a peer mentor, they should call us.
Okay.
And the number is 1-855-653-7337, or they can email us at nkfpeers, at kidney.org.
Good.
To
Wow.
remember all these numbers.
That's good. Let me see. What else? I'm going back 1 second at trying to open up different places to help kidney patients is very hard because I have a website, blessedkidneyconnections.com, and what I do is I connect the patients to the things they need. So if they say I need a job, I connect them to a job. If they say I need housing, I connect them to housing as a social worker, and and I do it voluntarily. I don't give any money for this.
Yeah.
If they need, they have immigration issues or anything of those natures, I help them. And that's www.blessedkidneyconnections.com. Blessed with an ED, connection with an S.com. Now, we're going back to the peer mentor. If a person wanted to become a mentor, they feel enthused, they're ready. Well, they feel they're ready. They feel they're ready, and they want to do this thing. What are the steps they would have to do to become a peer mentor?
So the first step is just calling the same number I had mentioned before. So again, it's 855-653-7337. And they'll talk with me, and I would just interview them, get to know a bit about their experience with kidney disease, why they want to be a peer mentor, and their availability. How much time do you have available to talk with other people? And then we do have quite a waiting list of people who are interested in being mentors, which is wonderful. We have a lot of interested individuals. But certainly people can still feel free to call, and we just add them to the list. And then as we need new mentors, we do trainings periodically throughout the year, and I would keep those people up to date of when those trainings are.
Okay.
So,
Okay.
and as you know, I guess the training is, usually over conference call with other mentors, and we have a training manual, and there's a few homework assignments just to learn how to become. Yeah, it's light, but still, we like to be interactive and do some role plays, and so that people feel comfortable being a mentor with us.
Yeah, that was one of the fun parts because you had we had to do this over the phone, and I would be coming out of dialysis sometimes, getting into the transportation to go home, and I'm on the phone with you, still trying to do my class and running, trying to do my class, getting into the house or trying to stuff something in my mouth, trying to do the class. But it was still easy to do, and it was still interesting to do and fun to do. It's something that you should maybe want to do or something that's just good to do. Yeah. It's good to do because patients go through so many things and they just don't know there's help out here. They don't know there's support out here. Yeah. What I love too is that the Kidney Foundation has a lot of programs. If you want to educate the community, sure. They have programs. They have books. If you like, when I go out to speak in public at colleges or churches, or any place, or doing street fairs or health fairs, I would call and get a bunch of your pamphlets, and then I'll set up a table and I do awareness all the time. So anybody could call and get some of this information and take it to their local places and give them out, whether they give them to the neighbor or a friend or family member. Sometimes I mail them. Sometimes I hand them out. Sometimes I give a speech as I hand them out, or ask them what do they need to know or want to know, or get this pamphlet if you want to know this, get this pamphlet if you want to know that, and it's helpful.
Yeah, and we'll mail it out for free if people give us a call. That's our patient hotline. So if people are looking for information about kidney disease or resources, like you mentioned, they can give us a call and we'll mail that out free for them.
Same number or different number?
Different number. It's similar though. It's 855-653-2273, or emailing nkfcares, CARES, @kidney.org. And that's we have trained professionals that can answer a variety of questions, and we have a gazillion brochures that we're able to send out that are really nice and comprehensive, so people can become better educated about kidney disease or treatments, whatever.
Because I see that you cover diabetes, high blood pressure. You even cover different ways of why you on dialysis. Why you're on dialysis. What the symptoms are, the vocabulary of it, or the talk. What is that? The lingo. The lingo of what you're trying to get across or say. I thought it was wonderful. You even have something that covered teens. Because I recently had 2 young people in my family dealing with PKD, polycystic kidney disease, and I called some places, including you guys, to send them mail or tell me an area in Pennsylvania for them because they were only 8 and 16 years old. So that was like a heavy blow to them. But once they're becoming advocates too, I'm so proud of them. They're becoming advocates too. I've also interviewed them, for the show and everything like that. So their show would be also on qpt.org as well as YouTube.
Oh, great.
So I thank you for helping me with so many people I've called you about and called for some of the people I had to call for them so you could help them. Because some of them were shy or afraid or didn't believe that you really existed. So I said, well, maybe once I can get you to mail them something or talk to them over the phone, it would be a lot better for them. You would think would be easier for somebody just to call you to get help, but sometimes they go through me just to get to you.
Sure.
So whichever way it's done, I'm going to do it, and I'm sure you are.
Yeah, we're happy to help. We feel as NKF that knowledge is power, and like you said with the lingo, there's so much to learn. There's so many medical terms that patients have to learn so that they can become part of their care and take the best care of themselves. So we feel like if we're able to help explain some of those complicated terminology and give people the tools that they need to live well on dialysis and to do the best they can, with the treatment that they're on. Yeah.
Well, I'm glad you're in this type of business because this could not be an easy business for somebody on my side of the fence or even on your side. You know what I mean? Because sometimes not that I can forget that I'm on this side of the fence, but when I see them on the other side of that fence, it's sometimes tough for me because you see family members that wish they could do more. You see people that co-workers wish that they can do more. And some of them have offered to walk for me, if, walk for me, or, and you would do what they can to encourage me or somebody else on dialysis.